Reports of rare blood clotting in 6 women in the United States who were given Johnson & Johnson's coronavirus vaccine temporarily halted the distribution of the drug in America, Europe and in other parts of the world as European medical authorities review the situation. This came after similar reports of blood clotting coupled with a fall in platelet counts in people who were administered the AstraZeneca vaccine, which also uses an adenovirus vector mechanism to build immunity in the body. Is there a link between the design of these vaccines and the rare but potentially fatal condition? And are certain people more at risk? And how will this affect our vaccination programs around the world? To address these questions, we connect with 2 medical experts today. Dr. Bruce Wiley, Professor of Health Policy and Management at City University, New York, and Executive Director of Public Health Informatics, Computational and Operations Research. We also connect with Dr. Nikolai Petrovsky, Research Director of Vaccine and Professor of Medicine at Flinders University. Very warm welcome to you both. Thank you for joining us. And well, my first question goes to you, Dr. Lee. Now, does it seem like these vaccines that use the adenovirus vector platform induce the forming of blood clots, or do you think it could be due to some other factors? I mean, some studies suggest that COVID-19 itself can cause clots in hospitalized patients. So at this point, what kind of questions and possibilities are scientists considering right now?
Yeah, so far these clots, and they're special types of clots. They're cerebral venous sinus thrombosis. So they're basically blood clots in the veins that drain blood from the brain. Have been seen in a small number of cases with the Johnson & Johnson vaccine, so 6, and a small number of cases with the AstraZeneca vaccine. Both of these are adenovirus vector vaccines, as opposed to the mRNA vaccines, which are the Pfizer and Moderna vaccine. Now, what they found is these clots have happened in women that are between the ages of 18 and 60, and most of the women have had what's thrombocytopenia, a low platelet count. So that might be related. Right now, for instance, the FDA and the CDC has initiated a pause in the use of the J&J vaccine to really go back and look at the cases and saying, you know, what is really leading to these clots. So it's not clear the actual mechanism that may be involved, but that's what's known so far. So the question is it, you know, the low platelet counts that are really contributing, and, you know, what's actually going on?
Now, Dr. Petrovsky, how many vaccines rely on this adenovirus vector platform? Do you think all vaccines using this approach should be halted from use for the time being?
So what we know is that this is quite a common platform. So apart from Johnson & Johnson and AstraZeneca vaccines, which both use this platform, the main vaccine from Russia, called Sputnik, is also using adenovirus technology. And similarly, a number of the vaccines out of China are using this technology. So it potentially, if this turns out to be an issue of the adenovirus platform generally, then it's going to have a massive impact on vaccine supply throughout the world. You know, how should we react? Well, everything is a risk-benefit analysis here, and therefore, because these side effects are relatively rare, it's estimated somewhere between 1 in 100,000 and 1 in 200,000. If you have a lot of COVID in the community, and that's, you know, adversely affecting, you know, 1 in 1,000 people, then obviously you're going to benefit a lot more people than you're going to hurt with the vaccine. Conversely, if you have a country such as Australia that has no current COVID-19 infections in the community, then you potentially could be harming more people than you're helping with the same vaccine. So this really is a decision that's going to be different country to country, and we have to rely on our regulators to make those risk-benefit assessments.
And Dr. Petrovsky, how rare are the occurrences of this side effect compared to the probability of getting life-threatening conditions from other vaccines in general?
Well, again, every vaccine is different. It comes down to the risk-benefit, and you know, typically There's no such thing as a 100% vaccine that causes no side effects, but obviously we need the side effects to be very low. Ideally, less than 1 in a million. On the whole, this particular side effect is more common than we would see with other vaccines, and particularly concerning is the fact it's affecting young women, and obviously young women are not at a high risk itself of problems from COVID infection. So it's not so much about the percentages. It's about which people in the population is being affected by the side effect, and are they getting a benefit from the vaccine.
And Dr. Lee, in the United Kingdom, Europe, and in your country, the United States, most of these rare blood clots have occurred in vaccinated women younger than 60 years old, relatively young women, as Dr. Petrovsky just pointed out. And now other countries are also recommending that young people receive mRNA vaccines instead. Are certain groups of people more vulnerable to this adenovirus vaccine? And well, who do you think should get a different vaccine for the time being?
Well, so far the risk factors are, what we mentioned, the low platelet count, the thrombocytopenia, and then, so far it seems to be women within the age group, so it's not quite clear why that is the case. So at this point, certainly in the United States, there's been an overall pause, meaning that you can't get the J&J vaccine. Now, in places where there may not be a pause, well, the question is whether someone, if they do have a low platelet count or thrombocytopenia, then maybe you might want to opt for another vaccine. And so right now, those are the risk factors that are known. So one of the keys right now is to really figure out, how does the risk actually break down by subgroup. So we know that, so far there were 6 cases among the over 6.8 million doses that were administered in the U.S. So that's a relatively low number. But the question is, are there particular subgroups where that risk is higher?
And Dr. Lee, how dangerous is the blood clotting condition? Can it be diagnosed in time, and also is it treatable?
Yeah, so this is I want to emphasize this is a serious condition. So there's been some misunderstanding on social media and other places that these are the same types of blood clots as blood clots in the legs, or blood clots that you can get with oral contraceptive pills or smoking and things like that. These are different. These are specifically blood clots that are in veins that are draining the blood from the brain. So the trouble is, if you block off those veins, you actually might have bleeding in your head, inside your brain, and that is almost always a life-threatening or life-concerning problem. So it is a serious condition. That's the reason why the FDA CDC is pausing, although it's very rare right now. So, and then the issue is, normally when you have blood clots like in the legs, you might give something called heparin, which is the blood thinner, but you don't necessarily want to do it with these types of clots. So one of the things that the FDA and CDC is trying to do is trying to determine what type of advice are they actually going to give doctors in terms of handling the situation. That's the main reason why there's one of the main reasons.
And now, Dr. Petrovsky, do you think this concern surrounding the blood clotting situation, do you think it's going to affect the development of other COVID-19 vaccines? Do you think this could potentially slow down worldwide vaccination programs?
Well, certainly in terms of its impact on other vaccines, if anything, it's going to increase the use of non-adenovirus vector platforms. So that should encourage the development of protein-based vaccines and more mRNA vaccines to really fill that void. But obviously that all takes time to replace one technology that many countries were in fact completely putting their faith on and not developing the other vaccines. So although the US obviously, arguably doesn't need the adeno vector because they've got to 60% population coverage with mRNA, there are many countries that don't have access to mRNA, so they were relying on adenovirus vectors. If they have to abandon those, obviously, they're going to need something else to replace it, so that's going to increase demand. But in the meantime, of course, they're not going to have any access to other vaccines. So, they either have to halt their programs or they have to push on, accepting that this is a rare risk, but one they might have to accept.
And Dr. Petrovsky, now the company-founded vaccine has been developing a COVID-19 vaccine, Vaccination, using a recombinant spike protein approach. Could you walk us through how this works and how effective this will be?
So, early on we put our faith in protein-based vaccines because this is the way most of the vaccines we currently use in our children are made, such as the hepatitis B vaccine and the polio vaccine. So these are all based around proteins. In our case, we make protein synthetically in insect cells. It's very pure. It doesn't involve viruses in the final vaccine. And we believe that this certainly, should be a very safe technology. And one that's easy to roll out because it's temperature stable. So it means you don't need -70 freezers to store it. So we're hopeful that that will become available as we progress through this year. And of course, there are other companies like Novavax in the United States who are similarly trying to produce a very similar protein-based vaccine. So I think once those protein vaccines become available, they may well become the vaccines of choice, just because we know from past experience these are extremely safe and effective.
Well, we've got some similar initiatives here in South Korea, so hopefully we'll see more progress worldwide. Well, Dr. Lee, now all of this during the past year, it's been a very confusing time for members of the public as government responses, they do tend to differ by country, and in many cases they can be quite politicized. Could you tell us what you are doing at your organization to aid solid decision making?
Yeah, so we've been in the pandemic preparedness response community for over a decade and a half. Like for instance, during the 2009 H1N1 pandemic, our team was embedded in the U.S. Health and Human Services, helping the CDC, Homeland Security, et cetera, respond to the pandemic. And we've helped with the Zika outbreaks, the Ebola outbreaks, and then now we've been helping with the national health response. So we've been running computer models, throughout the past year to show what the impact might be in terms of different policies and interventions. So, for instance, before the vaccine was made available, we ran many different types of simulations to establish the efficacy targets that different manufacturers should aim for. Like, for instance, one of our models recently was adapted by the New York Times to serve as an interactive tool so people can see when we might be reaching herd immunity. So we're continuing to provide sort of computational approaches and techniques to help with decision making, both domestically as well as around the world, because we think it's very important to maintain, active communication amongst all the decision makers and really disseminate a lot of the scientific findings. We really need to be guided by science. The countries that have been able to control the virus well have followed science, and the ones that haven't have not. So it's key to really follow.
That was Dr. Bruce Wiley, Professor at City University in New York, and Dr. Nikolai Petrovsky at Flinders University in Australia, both joining us from New York and Adelaide. Thank you both so much for your time today.
It's a pleasure.
And to our viewers, as always, thank you very much for watching.